So Rebecca, let's talk about cervical cancer. Firstly, how common is it and whereabouts in the body is the cervix?
So the cervix is the opening between the vagina and the uterus, which some people might know as the womb. Cervical cancer is rare. It's less than 1% of all cancers. It's about 3,000 cases a year, but it's important because 99% of those cases are preventable.
Wow.
And that's really because of this link between HPV and cervical cancer. It's also really important because as a cancer, it's quite unusual in that it really affects younger people. So about half of the cases that happen each year affect women under the age of 45, which is, a really difficult statistic.
Yeah, it's really unusual, isn't it? Because we know that most cancers get more prevalent as we get older, but cervical cancer is different in that sense. So how does HPV cause cervical cancer and how is it diagnosed?
We've talked a bit about HPV and the fact that it's a huge family of viruses. Only some of those will cause cervical cancer. It happens because when HPV infects the body, usually the immune system fights it off. Sometimes that doesn't happen. The cells start multiplying really quickly, and because they're multiplying so quickly, they accumulate lots of small changes that can lead to precancerous changes in those cells. And if that's not dealt with, then that can go on to develop into cancer. That's why the cervical screening is so important, because it not just looks for the presence of HPV in the cells, but if HPV is present, then it also looks for those precancerous changes that can be treated there and then reducing the chance of it going on to cause cancer later on.
I think it can be quite reassuring for people to know that the screening is actually to identify pre-cancerous changes. And if you always attend your screening, the chances of it ever actually becoming cancer are extremely low. But what are the symptoms of cervical cancer?
There may be no symptoms at all, which I understand is really difficult for people. But again, that points to the importance of screening, of testing in people without any symptoms. Really important for people to be aware of any changes in the pattern of their normal bleeding. So periods that are heavier than normal or bleeding in between periods. Also for people to be aware that any bleeding during or after sex is definitely a reason to see their GP. For women who have been through the menopause, then any bleeding after the menopause, can be a sign of all sorts of things, but also a reason to see the GP. I think changes in vaginal discharge and also pain during sex, particularly if it's new pain, should definitely be a reason to follow up with a medical professional. And finally, any ongoing pain that's new in the pelvis or the tummy or the back, also a reason to see a professional.
And how is cervical cancer treated?
So it depends on, how aggressive the cancer is and where the cancer is, but it tends to be dealt with by a multidisciplinary team in a hospital setting who will create a personalised management plan for you and your cancer. Treatment options include surgery, but also include things like radiation therapy and chemotherapy, often done together. And it may include a combination of all of those things. It's really a very personalised treatment plan that is created.
And really importantly, what can people do to reduce their risk of getting cervical cancer?
I mean, the vaccine has been completely revolutionary in terms of reducing the number of cervical cancers that are being diagnosed. So I think, it's really important to encourage our children to receive the vaccine. And, if you're part of a higher risk group that are being offered the vaccine, to take that up. I think the other thing is that, for people with a cervix, the most valuable thing you can do is to attend your screening appointments. That's going to be able to identify if you're, have contracted HPV and are therefore at risk of giving it to other people as well. And finally, I think it's really important for people to practice safe sex in general. Condoms, reduce that skin-to-skin contact for penetrative sex. They don't completely eliminate the transmission of HPV, but they can reduce it.
So I guess in summary, we're saying that cervical cancer, whilst not one of the most common types of cancer, is one of the most preventable types of cancer. And if we attend our screenings and accept a vaccine if it's offered to us, we can almost eliminate our risk.